Now, as the opioid crisis has gotten worse, healthcare premiums have gone up. Some experts attribute inflated premiums to the increased costs associated with mass opioid addiction. And just today, 3 law firms filed class action lawsuits in multiple states against distributors and manufacturers of opioids on behalf of health insurance purchasers. They claim that people who have and abused opioids are paying for the disaster that has essentially been created. But is this the best way to combat a problem of this magnitude? Let me ask one of the attorneys involved in these lawsuits, Travis Lankner. He's a managing partner at Keller Lankner LLC, and that is one of the 3 firms suing opioid manufacturers. Welcome to the show, Travis.
Hi, Kennedy. Thanks for having me.
So there are a lot of health crises that are driving up insurance premiums, not to mention Obamacare. Is this just a big cash grab on the part of major law firms?
No, unfortunately, it's far more serious than that. And the distinction, I think, that's critical to draw between some of the other public health issues that you mentioned and the opioid epidemic is a distinction that this is an epidemic that really was single-handedly created by the opioid companies as a result of fraud. They came in starting in the 1990s and upended decades of medical thinking, research, and practice about how we used opioids, previously used only for end-of-life care, closely supervised situations such as recovery from inpatient surgery, for example. After the 90s and after a lot of fraudulent practices that are detailed in our complaints that we filed today, the medical thinking changed as a result of lies that these companies deliberately told doctors and their patients. That is what led to the spike in opioid prescriptions, and that is what has caused the epidemic that we see today. So
But what if you have doctors say it's not fraud, it's not lies, this is the data that we had, this is where the science had evolved, and this is how we were forced to deal with pain management because we faced lawsuits from the other side if we didn't deal with pain appropriately?
Sure. Well, understandably, the suits we filed today are not filed against doctors. It's important to know. They are filed just against the opioid manufacturers and distributors for themselves having essentially created out of whole cloth the data that you're describing. The way we talk about pain and pain management today, the way a lot of doctors were educated in the 90s and early 2000s to talk about it, was by a lot of groups that claimed to be independent, but actually were fronts that were funded entirely by the opioid industry.
I understand that, and I understand that there's a lot of PR that goes into public education, whether it's opioids or alcohol or corn syrup. That doesn't mean that you get to sue entire industries and, jack up malpractice insurance fees so doctors can't afford to stay in business. At some point, we have to have personal responsibility. You have pointed out that 1 person every 16 minutes dies from an opioid overdose. Well, 1 person every 6 minutes dies from alcohol poisoning. 1 person every 7 minutes dies from complications that have to do with diabetes. And this is because people are drinking and eating and putting things in their body and not taking personal responsibility. So if your class action lawsuits are successful, are you telling me you're going to go after Budweiser and Nabisco?
No, there's a very clear distinction. I think the vast majority of opioid deaths that we see, even when they are from street drugs, are in patients who initially started because they were prescribed.
That is not true. That is actually, you are now providing false information, because a majority of people do not become hooked on pills and then just start shooting heroin. Some people do. A majority of drug overdose deaths have to do with people who are putting more than 1 drug into their body, like Heath Ledger.
In the opioid context, the statistics actually don't bear that out, particularly when the statistics include deaths not only as a result of the street drugs, but also from patients who are just taking opioids and haven't turned to any sort of other illicit substances. The real difference here is that we're actually filing these lawsuits to recover on behalf of consumers the costs that they already have been forced to pay.
Yeah, well, we've already been forced to pay a lot more in health care costs because people who suffer from obesity have $1,400 a year on average more in insurance costs than the average person, yet we're the ones who are forced to pay for that gap. So I don't think that your logic can be applied as patly as you think it can. It really does look like you're going after entire industries to enrich yourselves to the tune of, potentially billions of dollars. And it reminds me of that old joke, why don't sharks eat attorneys? Professional courtesy.
It's actually a libertarian principle that where product liability regulation doesn't step in, the tort law does. That's a Milton Friedman quote. That's a Milton Friedman quote.
The libertarian principle is personal responsibility, and you're taking that away from people. I will be curious to see how this plays out because it adds a new and interesting element to the conversation. Travis, thank you.